Welcome to your pre-op teaching video for your upcoming breast surgery. Now, before your pre-op appointment, if there were any studies such as a mammogram, ultrasound, or MRI that we needed to have completed, please get us those results well in advance of your pre-op appointment. If you were supposed to hunt down some old records or look for your implant card if you already have breast implants, these are very helpful for us to have prior to your pre-op. If you are a smoker, we recommend that you stop smoking at least 6 weeks prior to your surgery. Smoking is a deal breaker for breast reductions, breast lifts, and mastopexy augmentations, but it's really a good idea for nobody to be a smoker prior to surgery. If you have some more complex medical issues and you needed clearance from a primary care or specialist, please have that done before your pre-op appointment. And this is evidence that you're already preparing. Go over your paperwork, plan ahead for things like a caretaker or childcare so that you can have a smooth post-operative course. Now, 2 weeks before your surgery, it's important to stop all blood thinner medications and herbal supplements, just because those haven't typically been tested with anesthesia or healing. Common blood thinners include aspirin, ibuprofen, fish oils, and vitamin E. Be kind to your body and reduce alcohol use 2 weeks prior to surgery. I don't like patients drinking more than 1 drink a day, and the week before surgery, I think it's even best to stop altogether. Your liver is what makes clotting factors for your body, and it also clears a lot of the medications you're given. So if you can give it a break from also having to deal with alcohol, that's great. Review your teaching material and create a list of questions that you still have so we can go over those specifically at your pre-op appointment. If there were labs or an EKG you needed, this is a good time to get that done as well. Now, we use a lot of over-the-counter medications, Tylenol, Dramamine, or Meclizine, which are anti-nausea medications, antacids, antihistamines like Zyrtec, Claritin, and Benadryl, and even a laxative. These are all great things for you to have around the house prior to your surgery. We'll give you your prescriptions at your pre-op. We're crossing our fingers that someday we'll be doing this electronically, but for most patients, we're going to use an anti-inflammatory, a muscle relaxant, a painkiller, and some anti-nausea medication. So after surgery, a mainstay that we use is Tylenol. Tylenol comes in 2 strengths, regular, which is 325 milligrams, and extra strength, which is 500 milligrams. It's recommended that you take 1,000 milligrams 3 times a day for at least the first few days after your surgery. We don't want patients taking more than 4,000 milligrams of Tylenol. That would be 2 extra strength 4 times a day, because it starts to kind of overdo your liver a little bit. So with that 3,000 milligrams a day, that gives you 1 chance to take an extra dose just in case you need it. So this is a medication that we typically start the morning of surgery with a tiny sip of water before you go to the hospital. Celebrex is the anti-inflammatory that we typically use. I like to describe this as designer ibuprofen because it's nice and strong, it lasts much longer than regular ibuprofen, and it doesn't have the same bleeding complications that other nonsteroidals have. The pills that we prescribe are 200 milligrams, and each of these pills is going to last for an entire 24 hours. But right after surgery, when we know you're going to have more pain, we may use it a little bit more frequently than this. The dosage is based on your age and your kidney function because this is a medication that's cleared through your kidneys. So if you're under the age of 65, typically taking this twice a day as needed and then weaning down to once a day or stopping when you don't need it anymore is just fine. If you're over the age of 65, we don't want you taking this more than once a day as needed. So we start with 2 of them the morning of surgery with a tiny sip of water before you leave for the hospital. And if you're less than 65 years of age, you can continue this starting 12 hours after surgery. If you're over 65, you can start this the next day. Now, this used to be extremely expensive, and a lot of insurance companies would not fill it without pre-authorization. And we don't pre-authorize for cosmetic surgeries, but it has become much less expensive. And if you use the app GoodRx, you can find where it's dirt cheap. I got mine filled at Costco, and 20 of them cost me less than $20 when I had my prescriptions filled. Now, Valium is our muscle relaxant, and it's also an anti-anxiety medication. Remember Mother's Little Helper from the Rolling Stones? Well, they were singing about Valium. You can take one of these every 6 hours as needed, but it is sedating, so you want to stagger it with your pain medication so you're not taking too many sedating things at one time. You can start with one. If it's not really cutting it and you need to take another, like if you take the Valium first and then you need the oxycodone, that's fine, but just don't take them at exactly the same time. You could stagger them anywhere from 1 to 4 hours apart. Also, don't take this with sleeping pills or other anti-anxiety medications like Xanax or Ativan. Also, I think it's a pretty bad idea to mix it with THC if you usually use that as well. So we generally don't refill this because it is addictive. So try to make it count when you're taking it. If we do need to give you a few more, we can, but it's not one we like to refill. So because you're on those other medications already, hopefully you will need less narcotic pain medication. Now, in the past, we did a huge disservice to patients by telling them to stay ahead of their pain with narcotics. We've given you those other three medications to stay ahead of the pain. So the narcotics should be taken when you, not your caretaker, feel that the pain is bad enough, you're really going to need it. How do you know if you need it? Well, we want you to have enough pain control that you can get some sleep and that you can get up and walk around. But it is not realistic that you should have no pain. We actually don't want you to have no pain. That means you're over treating yourself. We want you to use some discomfort as a guide for the activities that you should and shouldn't be doing. The most common medication that we write for is oxycodone 5 milligrams. Now, this is the same narcotic that's found in Percocet, but it doesn't have Tylenol in this pill so that you can take your Tylenol around the clock no matter what. We start with one pill every 4 hours as needed. If you're having severe pain, it's actually okay for you to take two, but it's not something we want you to do long term. Remember, because this is also sedating, you want to stagger it with your Valium. So some people already know that oxycodone is a bad fit for them. We have other options like Ultram or Tramadol, which is a non-narcotic and it's a little bit weaker. Dilaudid, which is a little bit stronger, and then Norco, which used to be called Vicodin, but it already has the Tylenol in it. So you have to do some math to be sure you're not taking too much Tylenol. You just supplement the Tylenol to the Norco. Just as an FYI, we cannot phone in refills for narcotics, so don't wait till after hours of the weekend if you're going to need a refill. Now, narcotics tend to have a lot of side effects. Drowsiness and fatigue are two that are super common, but disorientation can also happen. A bad one is nausea, and narcotics are notorious for creating nausea. So it's important for you to have a little bit of food in your stomach before you take a narcotic. Narcotics are also very constipating, which is why it's a good idea to have laxatives around. They can also cause some generalized itching, and this doesn't necessarily mean it's an allergic reaction, but itching is common. They can be addictive. I think everybody has heard about the opioid crisis in the United States, and we don't want to be part of it. And thank God, none of my patients really want to have a problem after surgery. So we give you enough for your surgery, but not enough that it can create a long-term problem for you. So we will also write for a prescription strength anti-nausea medication called Zofran ODT. And what ODT stands for is an oral dissolving tablet. The generic term is ondansetron for this medication. So you can use one of these under your tongue every 4 hours as needed if you are nauseated. At the hospital, they're also going to put what looks like a little spot Band-Aid behind your ear or on your arm under a sticky saran wrap called a Tegaderm. And that is going to work for 3 days. These are really common for motion sickness, like on cruises and planes and things like that. But it does have some side effects. It can give you a dry mouth, blurry vision or dilated pupil, urine retention, which is typically why we don't use this in men, and confusion. So we may not use this on patients that are older. Once you remove this, whether it be because you're at the end of your 3 days or because you're having side effects, be sure to take a washcloth and soap and wash the skin where the patch was on your skin. And then wash your hands with soap and water after you've handled it. Throw it in a place where you don't have a pet that can get to it in the trash can because it could be bad for them if they eat it. Remember the Dramamine or Bonine that we recommended you buy? You can take that as well. So just as a good pointer, you can take all of these together. If you took your Zofran and it didn't work, by all means take your Dramamine or Meclizine. Same goes for the scopolamine patch. You can take these other things while the scopolamine is on you. The Dramamine does tend to make people sleepy, so if it's at night, this might be your first choice. So the night before surgery, it is important for you to understand your NPO orders, and that's the last time you can eat or drink anything. So for general anesthesia or sedation, you cannot have solid foods for 8 hours or full liquids, including things like milk and orange juice, for 8 hours prior to your surgery. You can continue to have clear liquids, which are water, Gatorade, apple juice, tea, black coffee, and Jello with nothing else in it, up until 4 hours prior to your surgery. And we know that a little sugar in your system is great. And if you're used to drinking caffeine withdrawal headaches are super common after surgery. So getting a little caffeine in your system is also a good idea. You can also start your Arnica Forte, which is, we give you in the hospital. It's it's a homeopathic anti-bruise and pain medication that includes arnica and also something called bromelain. Bromelain comes from pineapple and papaya. So if you have allergies to these, make sure you pass on that Arnica Forte. You also need to take your first antibacterial shower the night before surgery, and you will use either the Hibiclens soap, a little package we gave you in the office, or you can just use something like Dial, an antibacterial soap. Make sure you know your arrival time and place, and review your instructions with your caretaker. Our loved ones are there, or our friends, to take care of us, but they don't get all this information. So make sure they watch this video as well and go over any paperwork with you that you think they might need to know. You'll also possibly get a call from your anesthesiologist. So if you see another call coming through that you don't recognize, it might be them. So on the morning of surgery, you want to take your second antibacterial shower. Make sure you really get your armpits, your breasts, and your abdomen and your belly button. If you have inverted nipples, make sure you really clean that area well in addition, because that can be a hard area to clean. Don't put any lotion on the surgical site, and it's a good idea not to come in with a full face of makeup. Wear easy clothes to get in and out of, like maybe a hoodie with a zip up and some sweatpants. And you do want to take your preoperative medications with a tiny sip of water before you head to the hospital. For most people, this is going to be 2 extra strength Tylenol or 1,000 milligrams, 2 Celebrex, and a Dramamine or a Meclizine with a tiny sip of water. As far as your regular medications go, we only have people take what we consider super important or crucial medications. And we'll go over what you need to take of your regular meds the day of surgery, but most people skip everything except maybe certain blood pressure medications and maybe anti-seizure medications. Bring your surgery bra with you and leave it sitting out for me either on your countertop in your pre-op room or on your bed, because I need to sneak that back in the OR before we take you back. Now, after surgery, I will call your caretaker and let them know that you've gotten out of surgery okay. And then your recovery room nurse will give them a call when they have an idea of when you're ready to go home. Most people are in the recovery room for anywhere from about an hour to an hour and a half. If you had implants, you're going to go home with an implant card like you see here. This is super important. Don't lose it. I think it deserves a place like with your passport or your birth certificate or your social security card, because you need to find it if you have problems with a rupture and you need to use your warranty, or if you have future surgeries and I'm not around to have your records. Records in the state of Colorado are generally only kept for 7 years, and you may need this 10, 15, 20 years from now. So please keep it. You want to find a nice, comfy place to rest where your head of your bed can be elevated. You can sleep on your back, and you're going to keep your arms to your sides. We'll send you home with ice bags, and don't toss those. Keep using those ice bags as long as they help. It's a great form of pain control. I do have a pointer though. Though they have a blue like little latch at the top where you fill it, and they have some long strings on them. So tie those strings together in a bow, between two different bags and keep the little opening towards the top. That way you can put the strings behind your neck and each bag will fall onto each breast and you can move them back and forth. They won't slide around in bed. And because the opening is up, if they were to accidentally pop open when you're in bed, you won't get an ice cold bath. Walk around a lot, take a bunch of deep breaths. And when it comes to eating, eat kind of what sounds good, but avoid super spicy, super greasy stuff until you're sure your stomach's okay. Now, restrictions after surgery, we like your elbows to stay about 6 inches from your side, but your hands can come up, like up to your hair if you need to do that, but don't overdo things. We call this T-Rex arms, and that's a good description of how we want your arms to be after surgery. We want you to sleep on your back for at least 2 weeks or as long as it's comfortable. No straining, pushing, pulling, or lifting anything heavier than a milk carton. You want to avoid any cardio for 4 to 6 weeks after surgery based on what type of surgery you're having, because I have been burned so many times at about 3 weeks post-op, especially with implant cases where people are feeling better. They're kind of overdoing it. They're not following their instructions. And physiologically, this is a time that clots are dissolving in your body. And this is really when I have had to take people back to the OR emergently for a bleeding complication, is at about that 3-week point. So please continue to follow your post-op instructions for that 4 to 6 weeks when it comes to exertion. So showers are generally fine the day after surgery. If you have drains and implants, if you had more of a complicated implant revision surgery, I will specifically say whether you can shower or not. But for everybody else, showering the next day is just fine and even encouraged. Now, there's going to be some pads called ABD pads in your bra. They're kind of like big maxi pads. You don't have to put those back in after you take your shower. You might see some spots of blood on them, and that's totally normal. But if you do have drains, don't throw them away because you can reuse these as a little dressing around your drain site. Leave all the tapes on the incisions and everything can get wet. I recommend that after you take your shower, you put on a cotton t-shirt under your surgery bra. That way you have fresh cotton against your skin and it keeps the bra from kind of digging and chafing in the armpits and at the waist. You can also, if you have drains, cut a little side slit in that t-shirt to accommodate the tubing. But I think this makes people more comfortable and less itchy after surgery. You are going to be sent home with some white stockings that were used during surgery. And once you're up walking around a lot, you don't have to keep wearing those. So if you have drains, this is one of the more intimidating parts of surgery. We'll teach you how to strip them and how to empty them so that you can record that output. We recommend you do this 3 times a day, morning, noon, and night, and we'll give you a log so you can write down those totals. We will remove drains either at your first appointment if you're a breast reduction or a mastopexy based on the output, but almost everybody gets them out at their first appointment. For those of you that are still putting out a lot more than 25 cc's, we may leave them a little bit longer. Now, what comes out of that drain is going to look like blood for the first day or two. Then it's going to lighten up more like red wine. It's going to be red colored, but more watery. Then it'll brighten up as it gets thinner and thinner and look like cherry juice and even like apple juice. As it gets thinner, you may see some little flecks of stuff in the fluid, and that's nothing to be alarmed about. It's very common to see these long little stringy white or red clots that accumulate in the tubing, and that's why we have you strip them. You can kind of inchworm those down into the bulb. What's not normal is that the bulb rapidly fills and it's dark blood and it starts to clot in that bulb. So it's almost like thick jello and you can't get it out of that little spout when you try to empty it. That's not normal and I need a phone call. Also, what's not normal is if it gets milky and really stinky. If it looks like pus and smells nasty, that is not normal either and I need to hear from you. Sometimes you have to troubleshoot your drains a little bit. Some people have a lot of drainage and it may be coming out on the skin where it's coming out from your body. And so you may be alarmed that there's too much volume in your bulb. And remember what I said on the last slide, the thickness is what's concerning to us, not the volume. If it's more watery like red wine or like cherry juice, you can have tons coming out and we aren't going to be alarmed at all. But if it's thick and clotting in the bulb, that's a lot. If it's draining from the skin, it may mean that you just need to empty your bulb more, because when it gets more than halfway full, it's really not sucking anymore. It might also be kinking and draining around the drain site. So if there's too little drainage in the bulb, check to make sure it's not clogged or kinked, but it may actually just be that there's nothing much left to drain anymore. So it doesn't mean something's wrong if that drainage has really slowed down. The dressings typically stay on very well, but if for some reason all your dressings came off your drain site, you can put some antibiotic ointment there and take a bigger size bandage, put a partial cut in the telfa part so that you can fit that slit around your drain, and that's a good dressing that you can use as well. So what's expected after surgery like this is you are going to have some discomfort. It's surgery overall. You're probably also going to have one side that hurts more than the other, or one area that hurts more than the other. And that is all pretty expected. You might also experience quite a bit of numbness. Some of it might surprise you. I use some numbing medicine to inject. And it's up near the armpit area, and sometimes it can actually numb some of the nerves that go down to your hand. I promise it'll get better in a few hours, so don't be alarmed if you feel that when you wake up. But there can definitely be some nipple numbness or some skin numbness from surgery as well. You're going to be tired. And take advantage of the fact that you don't have much to do right after surgery, and get the rest you deserve so that when you do go back to work or having to do more activities, you're really rested by the time you get there. Now, you should also expect some bruising. Breast reductions and mastopexies bruise a lot, is something that is pretty expected. Breast augmentations typically are going to see more of their bruising straight down underneath their armpit and underneath their breast. So spatterings of bruising is pretty normal. You also may see a little bit of blood that soaked through onto those pads that we put in your bra right after surgery. That's why we put them there. Pretty normal to see maybe quarter-sized drops of blood, or maybe half-dollar-sized drops of blood on those dressings. You keep those pads if you have drains in, because if they didn't get too gross that first night, you can rotate those in by tearing along that blue line and then bringing the drain through that tear, so it sort of pads where it comes out underneath the bra. We'll go over that with you in the office. It's also normal for your body to hold on to a whole lot of water weight, and you'll probably see some weight gain and some puffiness in your face, in your hands, and in your lower extremities, but mostly in your belly. You will have a huge pot belly. People feel like they're about 5 or 6 months pregnant right after this surgery, and I promise it will go away. It's really just that your body hurts if it holds that core strength in, so it just relaxes everything. You'll also see a little asymmetry. You might feel kind of a sloshing if you turn your position. If you have implants, like a gurgle or a sloshing, that's totally normal. And you might experience a little bit of itchiness. What's not normal? A hematoma is arterial bleeding that happened after the surgery. So you will see a more sudden increase in pain, swelling, firmness, and then ultimately bruising. And while it could happen on both sides, it is almost always just one side that it happens on. So one side is distinctly different than the other. It's not subtle, it's very painful, and it happens generally really quickly. So you might also see a lot of blood that comes through on your dressings if this happens, or a lot of blood that is rapidly filling up your drains. We also don't expect to see higher fevers. Low grade, yes, 99 is normal. 100 wouldn't alarm us. But if it starts getting above 100.5, you might need to give us a call just so we can troubleshoot with you a little bit. It's almost always going to be from not taking deep breaths, but it could be from your IV site. It could be from a urinary tract infection. It could be from an infection at the surgical site, but right away after surgery, it is actually pretty rare to see any kind of sign of infection. Now, rashes are also not normal. It can be from a variety of things. What we want to treat early is in case it's a drug allergy. So you want to start antihistamines like that Zyrtec and Benadryl right away if you develop a rash. We also want to stop any medications that could be causing it. Now, antibiotics are the most notorious, and you got antibiotics at the time of your surgery through your IV, and I also washed you out with some antibiotics, most likely. So if you are, it could be from that if it shows up right away after surgery. If it's several days after your surgery, the most common medications could be the Celebrex or the Arnica Forte. So those would be the first two that I would stop, and anything else that you think might be causing it. Sometimes it's just a topical problem from the skin prep, but if it's in other areas of your body, like your lower extremities, behind your knees and your groin, stuff like that, it's most likely a drug reaction. So the most important thing is stop whatever could be causing it and start treating it rapidly with antihistamines. Give us a call. So we did operate on your chest, and you are going to have some pain, and it's going to hurt more when you take a deep breath, but you shouldn't have sharp stabbing chest pains and sudden onset of shortness of breath. That is not normal. It could be a sign of a blood clot, and we need to hear from you. Also, persistent swelling of a lower extremity with maybe pain behind your knee. That's also something like that is not typical, and it could be a sign of a deep venous thrombosis or a blood clot. Very, very, very rarely, I've seen one patient with an upper extremity clot. So it presented that way with at one hand becoming very swollen compared to the other. So also not typical after breast surgery is someone that drops their oxygen levels. And that can present as a really bad headache that just doesn't go away after you've taken pain medications, after you've hydrated, after you've had your caffeine, and especially if you're not used to getting headaches. A prolonged just nagging headache that won't go away can be a sign of low oxygen levels. So if you do have a pulse oximeter, you could check it, but that's sort of a red flag to us. So driving is different for each individual person. Most people are not going to be driving to their first follow-up appointment. You shouldn't drive until you've been off your narcotics and Valium for at least 12 hours. And you need to use good judgment. You don't want to be in a lot of pain because your reaction time may be really slow. Also, some patients might want to put a little pad or a pillow under their shoulder strap seatbelt so that it doesn't hurt their chest when they're driving. There are a lot of patients that never take any Valium or narcotics after surgery, and they may be easy, able to drive earlier than others. Some people need them for several days. So just like I said, use really good judgment. At your first follow-up appointment, bring a second bra to change into. We want this bra to be soft and super stretchy. The cups need to stretch as well as the band that goes around your chest. Bring a couple of options. You always want to start with a size that's a little too big because wearing something tight is going to be uncomfortable. If you have drains, bring the drain log in so we know how much output you've had. Make a list of questions at home so that we're sure to answer them when you come in. We'll go over your medications and your activities. And if you have implants in, we may start teaching you how to massage. At your second follow-up, that's when we'll take those tape dressings off of your incision. If you're ready for scar care, we can start that, and we usually use silicone gel sheeting from our office. Sometimes it needs a little bit better healing, and we may start some wound care on that before you're ready to start your scar care. Again, we'll review your activities and restrictions with you, and most patients by this point are off all of their prescription medications except maybe the Celebrex, still taking the Tylenol as needed. All right, you are prepared. So remember, this will go more smoothly if you plan ahead, bring specific questions with you, and educate your caregivers so that they are not in the dark about what you're going to need after surgery. Take the time you need to heal, and by all means, follow your instructions.